Chapter 8. A Permanent Blackout. Riddle. A fly enters a room. Each day the number of flies in the room doubles, so that by the 60th day the room is full of flies. When is the room half full? Answer. The 59th day. Once again I had a flat tire. I stopped at one of the many curbside repair shops, which consisted of two young men with a tire iron and patching equipment, and had it repaired. It cost 5 gourds, and I knew it only cost 5 gourds, but as usual they were trying to gouge me for quadruple the price. The discussion was still in the polite stage when my repairman, a muscular adolescent, spotted an attractive girl walking by. Without even excusing himself, he made a beeline for her. Unlike American men, he did not waste any time and immediately asked her if she wanted to have sex that evening, even pointing to a rendezvous point. His friend, in case I did not understand, got a silly smile on his face and explained to me in sign language what they were discussing. He made a circle with his thumb and index finger, then licked the index finger of his other hand. He placed this wet finger in the O he had formed and moved it rapidly in and out. After watching this display, I said to the girl, who already was aroused, "Vous devenez enceinte. You will become pregnant." She looked at me, tensed her lips, and opened her almond eyes wider, puzzled. "Vous devenez enceinte," I repeated. She looked at her seducer, not upset that I was forcing my opinion on her, but bewildered by the strange statement this crazy blonde was making in barely comprehensible Creole. She understood me, at least the words I said, but it did not take a mind reader to deduce that this information was news to her. She had no idea that there was a relationship between sexual intercourse and pregnancy. Actually, I should not have been surprised, as many American ghetto teenagers do not know about the birds and the bees either. I continued, telling her that she would not be able to feed the child, but I may as well have been talking to my tire. She walked away, flashing a smile at her lover, neither comprehending nor caring about what I had said. The salivating repairman, who I think already had a premature ejaculation, took my dollar with no further argument. He had more important topics on his mind. I imagined this girl standing at one of our clinics in the near future, holding her emaciated and dehydrated infant. Tens of thousands of babies that cannot possibly be supported are produced every year in Haiti. Haiti, with 700 people per square mile, is already the most densely populated country in the Western Hemisphere. It is more than coincidence that it is also the poorest. It was in the 1950s that generalized awareness of overpopulation began, with dire predictions of worldwide unemployment, famine, breakdown of social structures, and war. While these predictions were not entirely accurate, the population bomb is still ticking, and in some third world countries such as Haiti, it has already exploded. In some circles, it has become fashionable to minimize the population explosion, as worldwide birth rates are declining faster than previously expected. Nonetheless, between 1950 and 1980, the population of the Third World doubled from 1.7 billion to 3.4 billion. Even with the most optimistic predictions, it will have doubled again by 2030. Most of the decline in population rate has occurred in China, which is employing draconian measures, and in the industrialized world, thus skewing the statistics. Meanwhile, the population of Africa has doubled in the last 20 years. In the next 25 years, it will double again. Tragically, it is not likely that food production and economic growth will keep pace. Disasters such as the mass starvation in Ethiopia may become commonplace. Catholicism in Haiti is Haiti's official state religion, although Protestant religions, especially fundamentalism, are rapidly making inroads. One missionary I met joked that Haiti was 80% Catholic, 30% Protestant, and 90% Voodoo. I initially felt that the Catholic Church's prohibition on birth control is the main cause of the high birth rate, but after working in Haiti and learning to speak Creole, I found this to be a gross oversimplification. The high birth rate is due to many complex factors that I saw firsthand every day: ignorance, poor family structure, increasing urbanization, the cultural role of women, the need for security in old age, the lack of economic development, and the unavailability of birth control devices and methods. I later learned that the presence of industrialization is a much greater prognosticator of a country's birth rate than religion. Thus, Ireland, which has not legalized abortion and has the Angelus on television daily, has a lower birth rate than non-industrialized Singapore, which not only has legalized abortion but also offers economic incentives for uneducated women to remain barren. Haiti's population grows at a rate of 2.2% a year as opposed to that of the United States, which grows at the rate of 0.7%. This figure is arrived at by taking the number of people who are born and subtracting it from the number of people who die or emigrate and converting this number to a percentage of the population. Actually, Haiti has a low population growth rate for a third world country because the death rate is so high. Nonetheless, the population of Haiti, like that of the rest of the third world, will double by the year 2025, and unless there is drastic change, there will not be a similar increase in economic growth. When Haiti achieved its independence in 1804, the peasants went to the countryside and resumed their primitive African farming methods. This depleted Haiti's soil so that the burgeoning population forced the peasants to cultivate mountainous land by stripping its trees to feed themselves. The wood is burned and sold as charcoal, Haiti's main source of energy. The results are predictable. With each rainfall, Haiti's precious topsoil flows into the ocean, and Haiti's eroded mountains are visible to anyone flying into the country during the daytime. Reforestation attempts have been fruitless, their main accomplishment being to distribute bumper stickers that say, "Umen ou plante pi bois in Haiti." Have you planted a tree in Haiti? The government has even resorted to guarding the remaining forests, but the peasants simply encircle the trees with a single cut, destroying the tree's circulation system so that several months later they fall. It is difficult to induce behavior that is in Haiti's long-term best interest in people who are starving. If the present trend continues, Haiti will be treeless by the end of the century, a green paradise converted to a desert in a matter of generations, just as the once thick forests of Ethiopia are now lifeless plains full of starving people. Without trees, the water table decreases so that the reservoir that furnishes Haiti's only hydroelectric power plant is low, causing frequent blackouts. A home-based generator is standard equipment in the homes of the elite, and business investment is discouraged by the lack of reliable power source. Unable to sustain themselves in the countryside, the peasants have been forced to emigrate to the cities, searching for non-existent jobs. The cities, without proper sanitation and housing, are unable to absorb this influx, resulting in enormous slums and shantytowns. The population of Port-au-Prince has doubled in only 10 years. The closed living quarters of such massive urbanization destroys the family structure, exacerbating the population problem. Especially discouraging was the pitiful women I cared for. Routinely I saw them. They were in their mid-30s, but looked 50, with their sagging breasts and their frames battered by a dozen pregnancies. When they stood up, their wombs protruded out their vaginal opening, and their rectums prolapsed out their anuses. Their multiple pregnancies had stretched the muscles that support these structures to the point where they were functionally useless. Of their 12 children, maybe 4 were alive. In Haiti, a woman's role is to reproduce. It is her cultural imperative, elevates her social status, and makes her desirable as a wife. As the Haitian proverb goes, "Les ou pas Jean Petit ou ce chien." When you don't have children, you are a dog. When a woman had a child, her social status increased meteorically. On the women's ward in Saint-Fie, I learned that there is a subtle complex hierarchy. Even if I lived in Haiti for 40 years, I would never understand it. But its most overt manifestation was the clothing the women wore. These loving, docile women would become tigresses, savagely fighting over the clothing sent as donations. Those high on the pecking order decked themselves out in colorful handkerchiefs, bracelets, and chains. Those who lost sobbed for hours simply because they did not get the belt they wanted. More than clothing was at stake. It was their status. Visitors would come and distribute jewelry, often to the weaker and sicker patients. The pandemonium that erupted was unbelievable. A lower status woman could not keep a nice piece of jewelry unless she had an Uzi. The other women ganged up on her, beating her and disrupting her few belongings until she gave up the desired status symbol. It is similar to the corporate structure in the United States. As one rises up the ladder, one must follow strict guidelines, such as moving from a Chevrolet to an Oldsmobile to a Cadillac. Woe to the man who violates this unwritten code, who appears with a Gucci belt while his superiors have Pierre Cardin, or who dresses his wife in an ermine coat at the annual Christmas party while the boss's wife is attired in imitation mink. He will soon be doing flange inventories in northwestern Montana. When one woman who was staying at Sanfi had her baby, she was permitted to have a new wardrobe, a bright red dress, earrings, gold-colored bracelets, and even a bra. There was no argument. She deserved it. She had fulfilled her role and reproduced. It did not seem to matter that she had no husband, no job, and no support. She was a mother, period. In rural Haiti, there exists a complicated family structure that extends beyond the nuclear family. Unfortunately, the increasing urbanization has caused this structure to disintegrate. One day at the clinics, within 15 minutes, I found 3 children with severe kwashiorkor who needed to go to the children's home. Each of the mothers were pregnant, and they had had 6, 8, and 10 children. None of them had husbands, and they continued to generate babies. This is why at least 1/5 of the children die before they are 5 years old. One time, I became so upset that I actually yelled at a patient. The sisters brought a mother and child to the children's home. The child had kwashiorkor, and around his eyelashes was a pink outline. The corneas of his eyes were opaque with ulcers in the middle. He had severe vitamin A deficiency. I had had a terrible day, and this was the last thing I wanted to see, a permanently blind baby. "How many children do you have?" I barked in Creole. 8. "Do you have a husband?" "No." The cumulative frustration of seeing hordes of unhelpable children poured out of my mouth. "Why do you have babies when you can't feed them? Do you realize your child is blind? You need to stop having sex." Her face did not change expression as I humiliated her, and after realizing what I had just done, I decided to quit for the day. This emotional outburst was unfair, as many women, unable to support their families, are forced into prostitution, the only work they can find. They continue to have unprotected intercourse, generating more mouths to feed. The men are polygamous, with powerful and successful men taking more than one wife. Having many children is a sign of virility, and some of my male patients bragged about it. I made the mistake of asking how many were still alive, only once. After that, I did not want to know. As in virtually all societies, the ability to attract many women greatly enhanced a male's prestige. It also kept the women disciplined, as the Haitian proverb illustrates. Femme jalouse, pas jamais vinigre. Jealous women never become fat. Well, no, that's not exactly true. Women were obligated to have sex, and more than once I saw beaten women who had not consented. They looked as if their faces had been used as punching bags. With swollen eyelids, ballooned lips, and split, bruised skin, they did not appear to be bitter, giving me the impression that they accepted it as a sex-related hazard. Once in a while, they would be accompanied by the man who hit them, affording me the opportunity to unleash a verbal tirade. It did not change anything, but at least it made me feel good. In the United States, I would never yell when a man beat a woman. It is considered inappropriate moralizing. Sex was considered as a biological rather than an emotional function. Unemployment was high, boredom rife, and as one man put it, there's nothing else to do. When there is a blackout in an American city, there is no television and people have nothing to do but go to bed. 9 months later, the babies arrive. In Haiti, the babies are always coming. as if there is a permanent blackout. The Haitians were not shy about sex. Anytime I took a date to the beach, the Haitian men, upon ascertaining that I spoke Creole, would ask me how much I wanted to allow them to sleep with her. They had no qualms about asking me about her anatomical details, never considering that these questions were rude. The lyrics of popular songs that blared over the radio would even make a lawyer for the American Civil Liberties Union blush. By far the most popular song was a song that had the lyrics "Pigou, pi long, pi appétissant," wider, longer, and more appetizing. This phallic reference blared all through Port-au-Prince and was also on many bumper stickers. While it would be easy to blame Haiti's rapid growth rate on promiscuity and irresponsibility, the underlying problem was the same as all the other problems: economic. Children represented the best investment for those who had no sense of economic security. As the Haitian proverb goes, petit c'est riche, pauvre malheur. Children are the riches of the poor. Unlike in the United States, where children rarely produce economically before age 16, a child in Haiti was useful by age 4, carrying water, harvesting crops, and watching other children. Many children in the slums and countryside worked 12 hours a day. They represented security in old age, and since so many of them died, one could never have enough. While in Haiti, I became convinced that improved health care was an illusion unless overpopulation was addressed. I could not see how these immensely complex problems of malnutrition, poor sanitation, and poverty could be solved while masses of children were being produced. Since the order I was working with was Catholic, I respected their views and did not attempt to do family planning, although several of the sisters surreptitiously told me that they thought that was what Haiti needed. I did have the opportunity to do family planning while working with a non-sectarian Dutch organization. I also met doctors, missionaries, and international family planning experts who inundated me with a variety of views on how to handle the problem. From this, I regretfully came to the conclusion that lowering the birth rate in Haiti in a short period of time would not be possible without totalitarian methods that would be morally reprehensible. The government distributes condoms and birth control pills at low prices, but they are mainly used by a small, educated minority. The illiterate, superstitious poor simply do not have the education or discipline to use them. In Haiti, Mardi Gras is a week of total debauchery and hedonism, where an entire country forgets its woes and enjoys life to the fullest. 9 months later, the babies arrive. The government wisely tries to use this occasion for education. Family planning t-shirts were distributed free. On the front, they had a picture of a man, woman, and child, while on the back, they depicted a method of birth control. One showed a picture of a condom and said, "Ac capote c'est ça net." With a condom, it is complete. Many people walked around with these shirts, but when I asked them what they said, they had no idea. I would explain to them the message of the shirt, and they would politely listen, humoring me with their attention and going along their way. Trying to dispense condoms was an exercise in futility. The Haitian men had a great disdain for them. When I treated venereal disease, I would dispense condoms since I knew that having my patients refrain from sex was not a viable possibility. Most men took them politely, but one time a patient became indignant, jeering at me and asking if I used them. I had assaulted his macho self-image. Although I saw over 10,000 patients while I was in Haiti, this was the only time one was ever rude to me. Once a patient asked me for a condom, and being suspicious, I asked her why. "My children use them as balloons." She was right. I often saw kids using a blown-up condom as a soccer ball. This was the main use of condoms in Haiti. Oral contraceptives did not fare much better. I rarely gave them because I felt uncomfortable exposing my patients to the many possible complications without being able to monitor their blood chemistries, especially their liver functions. However, I frequently cared for patients who had received them from another source and now appeared before me with their prenatal checkups. "Mais pas je sang. I don't have blood," one told me. I finally figured out after about 10 minutes that this meant she had missed her period. There were at least 5 words in Creole for period, and it seemed to me that each woman only knew one of them. The story was always the same. The patient did not understand that they had to take the pills every day, whether they were having sex or not. No matter how often I repeated this, explained the menstrual cycle, drew pictures, whatever, I could not get my patients to comply with this simple regimen. I spoke with one missionary, a nurse, who implanted IUDs as a method of birth control and felt this was the wave of the future in Haiti, since no patient participation was required. IUDs are coiled pieces of plastic or metal that are placed inside the uterus, disrupting the uterine wall and preventing the implantation of a fertilized egg. Once considered an effective method of birth control, IUDs have fallen into disrepute in the United States because they can cause permanent sterilization from an associated pelvic infection, which is invariably followed by a $1 million lawsuit. This nurse told me that she had no complications with this method of birth control, but that was not my experience. One woman came to Sanfi with abdominal pain and fevers. Unsure of her diagnosis, I treated her with antibiotics in case she had typhoid. What concerned me was that she was not a typical Sanfi patient, as she was well-nourished and attired in new clothes. The next day she was worse, profusely sweating with exquisite tenderness in all areas of her abdomen. I was afraid she had a surgical emergency, such as appendicitis, but since I did not have the equipment to treat it, I just gave her a high dose of painkillers and told the sister to try to arrange that she be taken to the general hospital. Several minutes later, while I was examining another patient, this patient called, "Dr. Joe, Dr. Joe." I returned to her bedside and she showed me a foul-smelling, blood-covered piece of plastic. Her IUD had fallen out. Now everything made sense. I found some rubber gloves and lubricant and proceeded to perform a pelvic examination. I explained everything to her and she was cooperative until my fingers probed deep inside of her and pressed on her cervix, the entrance to the uterus through which the IUD had been placed. At this point, she emitted a loud shriek. This is all I wanted to know. She had a positive chandelier sign, so called because movement of the uterus is so painful the patient jumps for the chandelier. It is diagnostic of PID, pelvic inflammatory disease, which is when the uterus and surrounding structures become infected. Her case did not entirely make sense because PID caused by IUDs often has no symptoms. Perhaps her IUD had perforated the uterine wall, causing peritonitis, or maybe she had an ectopic pregnancy, which occurs when the fertilized egg implants in its transport tube instead of the uterus itself. Ectopic pregnancies are another complication of IUDs. The sisters took her to the general hospital, but the staff refused to admit her, which took a lot of chutzpah since they were the ones who had implanted the IUD. There was not much I could do except add another antibiotic. Over the next 2 weeks, she languished while I helplessly manipulated her antibiotics, hoping I could hit on the right combination. I never did, and she died, forcing me to wonder whether it was fair to put these things in people when they did not have access to the medical care to treat complications. I saw several patients like her who did not die, but during my stay in Haiti, I never implanted a single IUD. Another missionary I met felt she was working with the wave of the future in third world birth control, injectable estrogens. The most common of these is Depo-Provera, which is employed extensively in Southeast Asia. Because it has rendered some women sterile, the FDA has prohibited its use in the United States. She injected many women in northern Haiti with good results and was of the opinion that the medical risks were negligible when compared to unbridled population growth. One missionary, an attractive, unattached 22-year-old, had a completely different approach. A fundamentalist, she believed that the Haitians needed to be taught Christian values, complaining that they had too much illicit sex. I did not see how this was possible, since sex was the only fun many of these poor people had. I did not argue with her, though, since it would not change her mind. However, she lost her credibility with me when she called me several months later. "Joe, can you do a pregnancy test for me?" I guess the Haitians converted her. One method of birth control that is natural but effective is prolonged breastfeeding. Breastfeeding is nature's method of birth control because it causes a hormone to be excreted that inhibits ovulation. A sexually active woman who nurses her child at regular intervals, including at night, has only a 5% chance of becoming pregnant per month as opposed to 25% in a woman who is not breastfeeding. In one African tribe, the Kung women breastfed their children until they are 3 and subsequently have much lower birth rates. The problem is that in Haiti, either the mothers are too malnourished to breastfeed or an outside organization gives them food for their children, resulting in decreased milk production. This increases the chance of pregnancy. Also, the avoidance of breastfeeding is a sign of upward mobility, a behavior encouraged by corporations who distributed artificial milk preparations to widen their markets. Thus, it is unlikely that nature's birth control will be a major factor in controlling Haiti's population. USAID, the United States Agency for International Development, had a family planning division, and I was fortunate enough to have the opportunity to speak to its director. A pleasant man of about 50, he did not have the burnt-out look of most other international development workers, although he had been doing this type of work for most of his professional life. He just did not have unrealistic expectations. He smiled warmly as I aired my frustrations in trying to cure malnutrition in single-parent families of 6 with no source of income, my limited success in distributing condoms, and the terrible side effects I had seen from IUDs. I was obviously not the first distraught physician he had ever heard. His avuncular approach did not mean he did not realize the urgency of the problem, and his office was filled with charts and graphs of worldwide population trends confirming the dire predictions of 30 years ago. He told me that working with the Haitian government was challenging, as it is difficult to convince a people that there are too many of their kind. It requires tact and diplomacy. Third world countries view attempts by the industrialized world to decrease their population as a subtle form of genocide. After having their resources stripped by multinational corporations, the wealthy gaze back at the consequent economic catastrophe and pontificate that there are too many people for limited resources or whine about the ozone layer. He disagreed with me when I told him that I felt many Haitians were not interested in birth control, implying that I was not patient enough. He told me that the use of contraception is actually decreasing in Haiti so that now only 10% of the women were using it. However, he pointed out that his research had indicated that almost half of the women would use it if it were available. He saw it as a distribution problem caused by a lack of funds. Whether access to contraception would improve the situation is debatable. I met one Catholic priest who had worked in Haiti for 10 years. He was quite liberal and did not have strong philosophical and theological objections to birth control, but he felt access to it would not make a major dent in the birth rate, pointing out that similar so-called advances in American ghetto populations not only did not lower birth rates, but may have contributed to their rise. I left Haiti convinced that its burgeoning population was its greatest problem. Of the hodgepodge of solutions, increased access to birth control, teaching responsible behavior, economic development, none seemed to address the problem's urgency. Perhaps the day will come when masses of third world populations are subjected to forced sterilization and abortion programs like China and India. The present one-child policy of China is resulting in female infanticide because a male child represents more economic security than a female one. In the future, China will have an undersupply of females to marry, which could cause social upheaval. Although I personally could never agree to this, I would not be surprised if drastic birth control measures became commonplace. And of course, that's what did happen in China, and that's been changed. They're allowed to have 2 and possibly 3 children because that what he said, exactly, that's what happened.